Welcome, everyone. My name is Kristen, and I'm on the Devoted Health marketing team. I want to welcome you to today's talk and Q&A on how to manage a chronic condition during the coronavirus pandemic. Today, we're very fortunate to have Dr. Carter with us again. For those of you new to our virtual talks and Q&As, Dr. Carter is the medical director here at Devoted Health. She received her MD from Harvard Medical School and her MBA from Harvard Business School. She's been practicing medicine for 8 years. For this session, Dr. Carter will be talking about how to manage chronic illnesses like COPD and diabetes during this pandemic. If you've joined us for one of our other coronavirus Q&As, we're using the same format with plenty of time to answer your questions at the end. Now, before we begin, let's go over a few notes on how to best participate. First and most important, for your privacy, please do not share any personal health information when you ask your questions. If you have specific health questions about your personal situation, please call our guides at 1-800-DEVOTED, TTY 711. That's 1-800-338-6833. If you think you're exhibiting symptoms of the coronavirus, we recommend calling your primary care doctor as soon as possible. Now, if you want to ask questions, there's 2 ways to do so. If you joined us through Zoom, that's the one we posted at the top of devoted.com, you'll want to click on the chat button to ask a question. A chat box will appear. Type in your question and hit enter. Be sure to include your name and phone number. In case we can't get to every question during the session, we'll call you and follow up. Feel free to start typing in your questions at any time. Now, if you're joining us through Facebook Live, you'll need to call our guides at 1-800-DEVOTED to ask your questions there directly. Please do not enter your questions into Facebook Live. Now, one final note. Since we at Devoted Health are all doing our part to stop the spread of coronavirus by working from home, our internet may be slightly spotty. We apologize in advance for any audio drop-offs. If audio is cut off, we will do our best to repeat the information. Now I'm going to hand it off to Dr. Carter to get us started.
Thank you so much for joining us today. This pandemic is extremely challenging for all of us, and we at Devoted hope to do everything we can to help you. I hope this webinar today on managing chronic diseases is helpful. Some of you may already have these chronic diseases. Some of you may just want to learn more. So I hope in any event, the presentation will have something for everyone. So next slide. First, we'll talk about just what is a chronic disease. So there are many chronic diseases, and they're defined by conditions that last by 1 year or more, and they require ongoing medical attention, limit your activities of daily living, or both. You may or may not have symptoms with chronic disease, which is why it's so important to continue to get regular care and to take medications as prescribed. Some examples of chronic diseases include diabetes, heart diseases like high blood pressure, congestive heart failure, coronary artery disease, lung disease like COPD or asthma, and cancer. And today we're going to focus on 4 chronic diseases that are very common: high blood pressure, congestive heart failure, COPD, and diabetes. Next slide. So before we go into a little bit more on medications and how to manage chronic diseases, I want to just give an overview first of these 4 diseases that we're going to focus on. So first one is diabetes. There are several different kinds of diabetes. So you may have heard of type 2 diabetes or adult onset versus type 1 diabetes or juvenile onset. We're going to focus today on the adult onset type 2 diabetes, as this is much more common and much more commonly seen in the Medicare population. So for type 2 adult onset diabetes, basically it affects the way that your body processes insulin. And so it doesn't process insulin as well. And the result of that is that you have too much sugar in your blood, or otherwise called high blood glucose. Symptoms of type 2 diabetes might include increased thirst, frequent urination, hunger, fatigue, blurred vision. These are all things that would be signs of having a very increased blood sugar. But in most cases, there are actually no symptoms at all, which is why it's so important to get regular care. Treatment for diabetes includes controlling your blood sugar through diet, oral medications, or injection medications, as well as insulin. The next condition we'll talk about is high blood pressure, also called hypertension or essential hypertension. High blood pressure often has no symptoms, But if over time, if untreated, it can lead to several health conditions such as further heart disease as well as strokes. High blood pressure happens when the force of the blood against the artery walls is too high, and so then the blood pressure number becomes too high. And that puts a lot of stress on your heart, which is why if untreated, you can have more heart conditions later on. The way that we treat high blood pressure is by eating a healthy diet with less salt, exercising regularly, and taking medications that can help lower the blood pressure. Congestive heart failure, or CHF, can occur if the heart doesn't pump well or if it doesn't fill well because the muscle is too stiff. In either event, the effect is that your heart doesn't work as well as it should. And the way that we treat congestive heart failure is to limit the salt intake, limit some fluid intake, and sometimes taking prescription medicines like a water pill to remove extra fluid. I should also mention that symptoms of CHF might include things like shortness of breath, fatigue, especially when exerting yourself, swollen legs, and a rapid heartbeat. COPD, or chronic obstructive pulmonary disease, is the last chronic disease that we'll cover today. There are two general forms of COPD. One is called emphysema, which is where the air spaces in the lungs are destroyed. The other is chronic bronchitis, where you've got increased mucus and inflammation in the airways. And in either event, it leads to chronic respiratory symptoms, such as shortness of breath or cough. The way that we treat COPD is by taking daily inhalers to help control symptoms and prevent flares, and also minimize further damage to the lungs. And then there are rescue inhalers and sometimes steroids that you take as needed when you have flares of your symptoms. Next slide. So why is it so important to treat these diseases? As I alluded to on the prior slide, if we leave chronic diseases untreated, it can cause more problems later on. Untreated diabetes can lead to kidney problems, eye problems, nerve problems such as neuropathy, and heart problems. Untreated blood pressure, for example, can lead to heart failure, strokes, or even kidney problems. And so ensuring that you take medications on a daily basis, if they're prescribed to you that way, is really important to help prevent these effects. Many chronic diseases are caused by certain behaviors, for example, smoking or poor nutrition. So that means behavior changes might help. So that's really important, and we'll talk about some of those behavior changes a little bit later on. The other reason why chronic disease treatment is so important, and part of the reason that we're talking about it today, is that people with chronic diseases are more likely to have more severe illness with the coronavirus. It doesn't necessarily mean that you're more likely to get the coronavirus disease, but if you do contract the virus, you may have a more severe course. And so making sure that you are in your top health and taking all your medications well is really important to make sure that you're in the best shape possible if you were to contract the virus. Next slide. So it's really important, of course, to know which medications you take and why. So what we'll do next is review some general classes of medications for each of the 4 diseases. So you get a flavor of the medications that are used, and you might recognize some of the medications that you're taking. But as always, it's important to talk to your doctor about your specific medications, especially any side effects you should watch for, and any contingency plans you might have. For example, an extra dose if you start to have more symptoms. And again, I'll say again that most medications for chronic diseases help prevent flares of the disease or progression of the disease. So even if you're not having symptoms, it's really important that you take the medications as prescribed every day. Next slide. So the first medications we'll go through are those for diabetes. Medications in combination with diet and exercise are really important to help treat diabetes and control your blood sugar. These medications can be used alone or in combination. Almost always, you'll start with metformin, which is a pill, and then add on additional medications as needed. Some of the medications listed here are pills, while some are injections. And some can cause low blood sugar, which is the ones I've starred. So it's important to know which ones those are and if you're at risk for having low blood sugar. Metformin, sulfonylurea, GLP-1 agonist, DPP-4 inhibitors, and SGLT2 inhibitors are all examples of medications that are not insulin, but they are used to treat diabetes. And then for insulin itself, you can have both mealtime insulin, which is shorter acting, and you might take in response to how big your meal is going to be or what your blood sugar is around the time of your meal. And then you'll have the basal insulin, which is something that you take on a daily basis that helps your body basically replace what it doesn't have and what it needs on an ongoing basis. And so that's something that you'll probably take the same dose every day and at the same time every day. The medicines, again, that I've starred are ones that can cause low blood sugar if the dose is too high or you're not eating regular meals. So very important to keep this in mind if you're on the sulfonylurea medicines or on insulin. Next slide. High blood pressure medicines are all medicines that work to lower the blood pressure. And there are several different classes of these blood pressure medicines: beta blockers, calcium channel blockers, ACE inhibitors, angiotensin receptor blockers, or ARBs for short, and diuretics. These medicines in combination with diet and exercise are very effective. You might be on one alone or a combination of several. Many people are on 2 or more medications to help control their blood pressure. And monitoring is done, of course, by checking your blood pressure, maybe at home, which we'll talk about later, as well as at the doctor's office. And your doctor will probably see you every 6 months or so to make sure that these blood pressure medicines are the right doses and make any adjustments. The most common side effects of blood pressure medicines is lightheadedness if the dose is too high. So it's important to know which medicines you take and which other specific side effects might come with them. But in general, lightheadedness tends to be the most common side effect. And if that's something you're experiencing, would be something to talk to your doctor about. Next slide. Next, we'll talk about congestive heart failure medications. And these medicines are divided into 2 categories: medicines that help protect your heart muscle and medicines that help remove extra fluid from your body that accumulates because your heart isn't pumping as well as it should. And so the medicines that help protect your heart muscle are beta blockers, ACE inhibitors, or angiotensin receptor blockers, or ARBs again. And the medicines that help remove extra fluid are the diuretics. Also, Lasix or furosemide or torsemide are the common ones that are used here. There are also combination medicines such as Entresto, which is a combination of a few different types of medicines, again, that mainly helps protect your heart muscle. I've bolded the diuretics as a reminder to talk a little bit more about these. Oftentimes, diuretics are used both as a daily medicine as well as a medicine that you might need to take an extra dose of if you're having any increased symptoms. And we'll talk a little bit more about what those symptoms might be later on. But the diuretics are ones that are often used, again, both as maintenance, but then also when you're having a flare. The most common side effects, much like the blood pressure medicines, are lightheadedness if the dose is too high. And it's important to know, again, specifically what you're taking and if there are any other specific side effects that might come with your medications. Next slide. Last is COPD. And COPD medicines help to make you feel better and more able to do your everyday activities. There are medicines that help, inhalers that help open the airways. Then there are inhalers that help reduce swelling in the airways, and there are lots of combinations of that. So the inhalers that help open your airways can be divided into 2 different categories: short acting and then long acting. The short-acting meds treat more immediate symptoms and are often used more so when you're having a flare. The long-acting inhalers are ones that you use on a daily basis, and they reduce or prevent your COPD symptoms, such as coughing or shortness of breath, and they help to reduce the risk of future attacks as well. So that's why it's really important to take your long-acting medicines every day, even if you're not having symptoms. Inhalers that help reduce swelling in the airways are inhaled steroids. Most common one is fluticasone or Flovent. Again, it can be in combination with some of the inhalers that help open the airways as well. But fluticasone or Flovent also is one that is used every day, as that helps to protect your lungs and help reduce the risk of future attacks, as well as make you feel better and more able to do your activities on a daily basis. If you had a flare of COPD, your doctor would likely prescribe further steroid pills and possibly antibiotics as well to help treat a flare. Next slide. So next, we're going to shift and talk a little bit more about self-care for these chronic diseases and what you can do at home to help monitor. Next slide. First, for diabetes. So the monitoring that you can do for yourself at home would be to monitor your own blood sugar. And it's best to talk to your doctor to find out if it's something that's necessary. Sometimes if you have what we call diet-controlled diabetes, meaning you're not on any diabetes medications themselves, it's not necessary that you actually check your blood sugars. So good to check in with your doctor to find out in your own specific case if it's something that's recommended. When you do monitor your blood sugar, the goal for fasting blood sugars is between 80 and 130. And then, and that goal or that number for your fasting blood sugar might actually drive what dose you take of your basal insulin or what dose you take of your pills that you're taking as well. The mealtime numbers that you get for your blood sugar help determine what insulin dose you might take for your mealtime insulin, if that's something that you're taking. And then in the office, the monitoring that is done, which is not done at home, but I'm including here just to make a note, is called the hemoglobin A1C. And that's a test that we like to see at 7 or below, typically. It varies, again, depending on your own situation, but we typically shoot for something around 7, and that's 7%. And that hemoglobin A1C is a measure of how good your blood sugar has been over the prior 3 months. So it's a really nice measure of how things have been going generally over a longer period of time. And you can't do that one at home, but it's good to just remember that you want to do that frequently with your doctor. But you can do your blood sugars at home, as mentioned. So then what steps can you take for your diabetes? So perhaps most important is to lose weight if you're overweight. We know that when overweight or obese, that makes diabetes worse and makes the insulin, your insulin production worse as well. And so losing weight is one of the best things that you can do, again, if you're overweight. The other thing that you can do to help, of course, lose weight, but also just manage your blood sugar as well, is to watch the carbohydrates that you eat. You want to limit the things you get from bread, the carbohydrates you get from bread, pasta, rice, and foods with added sugar. It's really best to get carbohydrates from things like fruits, vegetables, and whole grains. In general, you want to choose a diet that's low in sugar and also saturated fats, which can be found in meat, butter, and cheese. You want to do something active for 30 minutes a day on most days. And then you want to cut down on alcohol if you drink more than 1 drink per day for women and 2 drinks per day for men. And one of the main reasons here is because alcohol actually does have a significant number of carbohydrates as well as calories. And so by cutting down on that, you'll help yourself watch your carbohydrates and lose weight as well. Next slide. For high blood pressure, there's monitoring and steps you can take at home as well. And the monitoring for high blood pressure is, of course, checking your own blood pressure, which you can do at home with a cuff at home. And it's useful to do this at home because if you have sort of a borderline blood pressure, so your doctor's been concerned about potentially having high blood pressure, this could help with early diagnosis. So if you're monitoring early on, it might help actually diagnose high blood pressure earlier than it would than you would otherwise. If you already do have a diagnosis of high blood pressure, then monitoring your blood pressure at home can help track your treatment and encourage better control, and help to basically help drive changes in your doses earlier if you're able to let your doctor know that your blood pressure isn't meeting the goal. It's also important that you make sure that your blood pressure cuff matches that at the doctor's office. So right now, of course, not a good time to go to the doctor's office, but generally speaking, you should try to calibrate your own cuff with your doctor's cuff to make sure that you're getting the same measurement. It's also useful to monitor at home to tell if you tend to have a different blood pressure in the doctor's office versus at home. So many people will have a higher blood pressure in the doctor's office. We call that white coat hypertension because just being at the doctor's office itself makes your blood pressure go up a little bit. And so by monitoring at home, you'll be able to tell that as well. So a few other tips for checking your blood pressure at home. I already mentioned the first bullet, which is about checking the accuracy and just making sure that it matches what it says at your doctor's office as well. Other tips are in terms of how and when to check your blood pressure. So we recommend that you check your blood pressure twice a day. You don't necessarily need to do that every single day. Defer to your doctor in terms of his or her recommendations there. But measuring it twice a day gives you a good picture of whether or not your medicines are working throughout the day. We typically recommend checking first thing in the morning, especially before you've had any food or caffeine or tobacco, and then later in the day, usually around dinner time. You want to avoid, as mentioned, food, caffeine, tobacco, as well as alcohol for 30 minutes before taking a measurement, as all of these things can affect your blood pressure. You want to sit quietly before and during the monitoring and place a cuff on your bare skin, not over the clothing. So in addition to monitoring your blood pressure, some additional steps that you can take to help treat your blood pressure at home are losing weight, being mindful of your diet, and being active, much like with diabetes. So similar to diabetes, we know that when you're overweight or obese, that is directly correlated oftentimes with a higher blood pressure. And so by losing weight, you will reduce your blood pressure as well. Choosing a diet that's low in fat and rich in fruits, vegetables, and low-fat dairy is also very good for high blood pressure. Salt is really important as well. And you want to reduce the amount of salt you eat, as salt directly impacts your blood pressure as well and can lead to increases. And you want to do something similar with diabetes, active for 30 minutes a day on most days, and cut down on alcohol as well. And the reason here to cut down on alcohol is not only does that help you lose weight, like with diabetes, but it also, alcohol has a direct effect on your blood pressure as well. So cutting back is a good idea for that reason also. Next slide. Next is self-care and monitoring for congestive heart failure. So the monitoring that you may do includes a couple things. One is checking your daily weights. And this is really important to make sure that you're not gaining weight quickly, which would suggest that you're actually accumulating fluid and that your heart isn't pumping as well as it should. So making sure that your weights are staying steady is really, really important for congestive heart failure. You also want to check your blood pressure regularly. And this is helpful because many of the medicines that treat congestive heart failure also treat high blood pressure. And so you want to make sure that your blood pressure is in a good range, and you might need to adjust your medications if not. It's also important to monitor for things like changes in breathing, new or worse swelling, especially in your ankles and legs, and then changes in your ability to do just everyday things. So if all of a sudden you're not able to go up a flight of stairs, when normally that's something that you do without a problem, that might suggest a problem with your heart failure and a reason to speak to your doctor. So similar to diabetes and high blood pressure, the steps you can take are very similar, but with a few differences. Losing weight is, of course, still important. As you lose weight, you reduce some of the stress on your heart. So this is really important for congestive heart failure. If you smoke, it's really important to stop smoking, again, because smoking puts extra strain on your heart as well. Salt that you eat is especially important for congestive heart failure, and you want to limit it to 2 grams per day of salt. And all that information is on the labels of your food as well. You also want to do something active for 30 minutes a day on most days. Again, you want to cut down on alcohol if you're drinking more than 1 drink for women and 2 drinks per day for men. And it's also especially important for you to get your flu shot every year if you have heart failure. Next slide. Last is COPD. Monitoring for COPD is a little bit less than for the other diseases we've talked about. You may or may not have a pulse oximeter at home. You would likely have this if you're on oxygen for your COPD, but you may not have this or need it if your COPD is well controlled. So otherwise, it's really about monitoring your symptoms on a daily basis, but less so about monitoring any numbers specifically. The steps that you can take if you have COPD would be to make sure that you're up to date on your vaccinations. So that includes getting a flu shot every year, as well as making sure that you're up to date on your pneumonia vaccines. So that's both Pneumovax as well as Prevnar. They're 2 different pneumonia vaccines. For the most part, you just need it once in your lifetime, and it's usually around age 65. Sometimes you need a booster of the Pneumovax if you've gotten it before age 65, then you'll need another booster once you turn 65. But those are not vaccines that you need on a yearly basis. So it's important to make sure that you're up to date on those vaccines, and your doctor should have those records. It's also especially important that if you're still smoking, to stop smoking. Smoking, of course, would contribute to further damage to the lungs, as well as precipitating a flare of the COPD. So multiple reasons why stopping smoking is very important. You want to make sure that you know that you're taking your inhalers properly. Is basically therapy.
Dr. Carter, sorry to interrupt. You cut out right after saying take your inhalers properly.
Okay, sorry about that. Proper inhaler technique is, of course, very important. Your doctor or a nurse at your doctor's office would be able to teach you how to do that properly. And there are also online resources as well that can show you on videos how to use your inhalers. And the last piece is pulmonary rehab. Pulmonary rehab is is basically therapy where you go and you learn to improve your symptoms in new ways. So you learn exercises and ways to breathe that can help ease your symptoms and is really very helpful for a lot of people who have COPD. Next slide. So the next slides are going to walk through action plans for each of these 4 diseases. So we'll go through green, yellow, orange, and red. Green is when everything is okay, you're not having any symptoms and things, you should just take your medications as normal. And then kind of going from there up to red, where there's a true emergency. And we'll talk through kind of what numbers or symptoms might prompt you to think about those things. I'm going to give some numbers, as you'll see, as general guidance, but as always, it's important to work with your doctor to find out what's right for you. So first is diabetes. So you'll see you're in the green zone if you have normal blood sugars, so 80 to 130 when fasting, and you're not having any symptoms that might be suggestive of poorly controlled diabetes, like fatigue, lightheadedness, frequent urination, or excessive thirst. So in those cases, your symptoms are under control, your blood sugars seem to be under control. You want to keep taking your medications every day, checking your blood sugars, and doing routine care with your doctor as scheduled. You might be in the yellow zone if you have mildly elevated blood sugar when fasting or mildly decreased blood sugar when fasting. The numbers I've given here are a guidance. So 130 to 200 is elevated or mildly decreased, 60 to 80 range. If that's the case, it suggests you might need adjustments to your medications. It's not an emergency, but it's best that you call your doctor's office to find out what to do next. Next slide. Next, you would enter the orange zone. So this is when maybe the numbers are a little bit worse. So your blood sugar is elevated above 200 when fasting, or maybe you start to have symptoms that suggest poorly controlled diabetes, like frequency of urination, excessive thirst, or an unexpected weight loss of more than 5 pounds. In those cases, recommend calling your doctor right away because you might need to see someone right away for testing or for adjustments. The red zone is the emergency zone. So this is when you have very elevated blood sugar, over 350, very low blood sugar, together with things like confusion or passing out, pain or pressure in your chest, a fast or uneven heartbeat, new and severe abdominal pain, changes in alertness, in other words, you're feeling very confused, or if you have any fainting spells. All of these things, all of these symptoms or these numbers suggest potential emergencies if you have diabetes. And so in these cases, it's best to call 911 for an ambulance. Next slide. Next, we'll shift to high blood pressure and go through the similar green, yellow, orange, and red zones. So you're in the green zone if you've got a normal blood pressure. Again, everyone's targets are going to be a little bit different, so we recommend speaking to your doctor about your specific targets. But generally speaking, the top number is kind of 110 to 130s or so, bottom number in the 70s to 80s. That means that things are going well for you. You should keep taking your medications every day and keep checking your blood pressure. You might enter the yellow zone if you have either mildly increased blood pressure or mildly decreased blood pressure. But in either case, you do not have any concerning symptoms. So mildly increased blood pressure numbers might look like 140 to 170 as the top number, the bottom number being in the 90s, 100s. Mildly decreased blood pressure numbers, that top number might be 90 to 100, the bottom number might be 50 to 60. But importantly, again, you're not having any concerning symptoms like headache, chest pain with high blood pressure, or lightheadedness or passing out with low blood pressure. If you're in this yellow zone, you likely need adjustments to your medications, but again, it's not an emergency. So it's best that you call your doctor's office to find out what to do and get adjustments as needed. Next is the orange zone. So in this case, you might enter the orange zone if your blood pressure number gets much higher. So the top number is over 180 or the bottom number is over 110. But importantly, even if those numbers are high, you're not having any severe headache or chest pain associated with those high numbers. You might also be in the orange zone if you have decreased blood pressure numbers, such that the top number is less than 90 or the bottom number is less than 50. In these cases, we recommend that you see your doctor right away. You want to call your doctor now because you do need more urgent adjustments, but it's not something that you necessarily need to call 911 for. The red zone is, again, the emergency zone. So this is when the numbers are very, very increased and you're having symptoms like headache or chest pain that's associated with those high numbers. Because that suggests the high blood pressure is having an effect on your heart or on your brain. You also might be in the red zone if you have a very, very decreased blood pressure. So that top number less than 80, the bottom number less, that sort of 40 and the 50 range, and you're having lightheadedness, confusion, or you're passing out in association with that low blood pressure. That suggests, of course, that your blood pressure is much too low and you need adjustments there. I didn't mention the numbers for the red zone. So that top number, if you're over 200, or if that bottom number is over 120, those would be the numbers that we'd consider for the red zone for blood pressure. And in any of these red zone scenarios, we recommend calling 911 for an ambulance right away. Next slide. Next, we'll talk about the action plan for heart failure. So you'll be in the green zone if you're having no symptoms, like no trouble breathing, no chest pain, no weight changes. You have your usual amount of swelling in your ankles or legs, which hopefully is a small amount, and no changes in your ability to be active. And in that case, your symptoms are under control. So you want to keep taking your medications every day. And as we talked about in the monitoring part of the talk, keep weighing yourself every day and write down your weight. You might enter the yellow zone if you start having some new symptoms, like you need more pillows to sleep than usual because you need to be propped up a little bit more to help you breathe. You might be coughing more than usual or have more shortness of breath or more swelling in your legs. The other thing to note, and this is why keeping a close eye on your weight is so important, is that if you gain 2 to 3 pounds overnight or 5 pounds in the course of a week, that also means you might be accumulating extra fluid. It might mean that your heart isn't working quite as it should, or maybe that you just ate some extra salt and you've accumulated fluid. And in these cases, it means that you might need to take some extra medicine. So you want to call your doctor's office to find out what to do. And in this case, your doctor will probably advise you to take extra doses of your diuretic for a few days. And that will help remove the extra fluid. Next slide. You might go from the yellow zone, however, to the orange zone if the symptoms are getting a lot worse. So for example, if you're having trouble breathing when you're resting, or you can't stop coughing, or you feel some wheeze or chest tightness at rest, or you wake up at night because you're not breathing well, or you might be feeling dizzy or very tired, or you might gain or lose more than 5 pounds compared to your normal weight. In those cases, it also suggests that your heart isn't pumping as well as it should, that you've retained more fluid than you should, and you need to see your doctor right away for adjustments and for an examination. So in these cases, you want to call your doctor right away. The red zone, again, the emergency zone, is if all of these symptoms are a lot worse. So if you're having trouble breathing, that doesn't get better no matter what you do. You feel like you can't breathe. If you're coughing up frothy or pink saliva, you have pain or pressure in your chest, a fast or uneven heartbeat, or if you feel very confused, or if you faint. All of these symptoms are emergencies if they happen when you have heart failure. And so for these things, you want to make sure that you call 911 for an ambulance right away. Next slide. Last, we'll talk about COPD. And for these, we'll have just a green, a yellow, and a red zone. But similarly, you'll be in the green zone if you're able to do all of your usual activities. You've got your usual amount of cough and phlegm, you're sleeping well, and you've got a good appetite. In those circumstances, you want to continue to take your medications every day. If you use oxygen, you'll use it as prescribed, and continue with your regular exercise and diet plan. You might enter into the yellow zone if you're feeling a little bit more breathless than usual, have less energy than usual, increased or thicker phlegm or mucus production. You find that you're using your inhaler more often. You have more coughing than usual. Maybe you're not sleeping well and their symptoms wake you up. You have a poor appetite, or you feel that your medicines just aren't helping you. In those circumstances, we want you, of course, to continue taking your medicines, including your rescue medicine, but there's a chance that you'll likely need some extra medicine as well. So it's best to call your doctor's office to find out what to do. He or she will likely have you start a steroid pill like prednisone and maybe an antibiotic for what sounds like a flare. And in this case, of course, it's important to call your doctor quickly to find out what extra medicines you might need to help you feel better fast and prevent you from getting worse. Next slide. Last is the red zone. And so for COPD, this emergency zone would be if you were having severe shortness of breath, even at rest, you're unable to do any activities because of breathing, you can't sleep because of trouble breathing, you're having fever or shaking chills, you're feeling confused or drowsy, you're having any chest pains, or coughing up blood. In those circumstances, those would be emergencies if you have COPD, and so you want you to call 911 for an ambulance right away. So in summary, chronic diseases require ongoing medical condition. They limit activities of daily living or both. When left untreated, chronic diseases can cause more problems. And so it's really important you take your medications on a daily basis as prescribed, even if you're not having any symptoms of the chronic disease, which is often the case. It's important to know which medications you take and why. And so talk to your doctor about specific medications that you take and any side effects you should be aware of. Monitoring, such as watching your blood sugar, watching your blood pressure, watching your weights, are very important, as well as self-care for chronic diseases. And so be sure to follow your monitoring protocols and do anything for self-care that you can do at home as well. And then last, be sure to understand what symptoms or numbers should trigger medical attention. And think about those green, yellow, orange, and then red emergency zones and when you should seek medical attention. Next slide. So this concludes the presentation, and we'll open it up for questions at this point. Happy to answer questions both about the chronic diseases and the material that we went over today, as well as just generally questions about the coronavirus. As a reminder, if you're joining via Facebook Live, please do not answer your questions online, but instead we'd be happy to answer your questions if you call us at 1-800-DEVOTED. If you are joining on Zoom, you may enter the questions by clicking on the chat button. Please include your name and phone number so that we can get back to you if we don't answer your question today. And as a last reminder, please, of course, don't share any personal health information.
Thanks so much, Dr. Carter. So the first question we got was, right now I can't go in to see my PCP physically. So what are my options for getting care from my doctor?
Great question. So it's, most PCPs and really most care is now being done virtually through telehealth or telemedicine because we think it's the safest thing to stay at home and to not go into the doctor's office if you can avoid it. And so telehealth or telemedicine is something that is now being offered by almost every provider. Best to call your provider to find out exactly what he or she is offering during this time. And telehealth or telemedicine means that you might have a visit just over the phone or even on video. So instead of going in and seeing your doctor live, you can do almost a lot of care, including care for chronic diseases over the phone or over video. And it's a great way to be able to stay in touch with your doctor and make sure that your symptoms are under control, that you're taking the right medications, go over any of your monitoring with your doctor as well. So encourage everyone, if you haven't already, to reach out to your provider to find out what they offer in terms of telehealth and then follow up via telehealth to make sure that everything's going okay for you.
Okay, great. So the next question is, are there any other resources that I can go to for help on how to manage my diet and exercise?
Yes. And there are several very good websites that many sort of disease organizations maintain. For example, for diabetes, the American Diabetes Association has excellent information for patients on what you can do for diet, what you can do for exercise, and just general education and tips about diabetes. The same thing is true on the American Heart Association website. They've got a lot of great information about heart failure, about high blood pressure, and the ways that you can help manage that at home. And then the American Lung Association for COPD, similarly, has tips and strategies for how to manage things at home as well, diet recommendations, exercises, everything like that. So we recommend these websites, again, the American Diabetes Association, the American Heart Association, and the American Lung Association.
Great, thank you. And as a reminder to everyone viewing on Zoom, please don't hesitate to ask any questions in the chat about the topic of managing chronic conditions or coronavirus in general. So our next question is, and it looks like you may have touched upon it during your presentation, but looking for a little bit more elaboration. If I have one of these conditions, am I more at risk for getting coronavirus?
Great question, and something that, of course, everyone is very worried about. We don't believe that you'd be at increased risk for contracting the virus if you were to have a chronic condition. But what we've seen from information from other countries earlier on in the epidemic, as well as what we're starting to see in our own country, is that people who have chronic diseases such as high blood pressure, heart failure, COPD, diabetes, cancer, unfortunately are at higher risk for more severe disease. So as you've probably been following in the news, there's a really wide spectrum of severity with the coronavirus, ranging from people who have no symptoms at all to very mild symptoms to more severe symptoms requiring hospitalization. And we worry that patients who have these chronic diseases are at risk for the more severe disease with coronavirus. And so, again, while we don't think that you're more at risk for contracting the virus, we're worried that you might have a more severe course if you do. So if that's the case, a few things to keep in mind. Can be in.
Sorry,
So
Dr. Carter, you cut off right after a few things to keep in mind.
oh dear. I'm sorry about that. Can you hear me now?
Yes. Yep.
Okay. So I'm not exactly sure when I said that, but I'm going to back up a little bit. So I apologize if this is repetition. What I was saying is, folks with chronic diseases are unfortunately at risk for more severe illness with coronavirus. And that's what we've learned through the experience in other countries as well as our own. And so the few things to keep in mind would be, number one, making sure that you stay at home and stay safe. And so really by continuing to practice social distancing and preventing yourself from being exposed to the virus, that's really one of the best things you can do for yourself. The other piece is that it's important that you are in the best health that you possibly can be in. So if you contracted the virus, you're in as good shape as you can be going into the illness. And so what that means is making sure that you're taking all of your medicines as prescribed, that you're not having any symptoms that would suggest that things aren't well controlled. So those are the symptoms we talked about, like trouble breathing, extra fatigue when you're exerting yourself, things like that that would suggest that maybe things aren't as well controlled as they could be. And if that's the case for you, recommend, of course, reaching out to your doctor to find out if any adjustments could be made, again, to make sure that you're in the best shape possible and you're in the best health that you can be during this time.
Okay, great. So this kind of goes back to maintaining a good diet and exercise. So what are some of the things that I can do for my 30 minutes of active time?
Great. So, I'll say up front that it's important, of course, to make sure that your doctor feels it's okay for you to exercise. And in some cases, if you have very severe heart failure, for example, your doctor may have some recommendations or some modifications for you. So always important before you start exercising to make sure that your doctor feels it's safe for you. But generally speaking, some of the things that you can do, and you can still do now, despite the pandemic, is go for walks. So walks are a great way not only to get outside and get some fresh air during this time, but also to make sure that you're getting your exercise. And so walks are great. There are a lot of exercises that you can do just in your home and not needing any extra equipment, but variety of different body weight exercises that you can do. And again, some of those websites I mentioned would have some specifics around things that you can do at home, like going up and down stairs or doing squats, things like that that you can do at home without any extra equipment. And so kind of the combination of those two things would be the best at this point if you don't have any special equipment in your home. And that is getting outside and going for walks, as well as, doing some exercises in your own home without the need for extra equipment.
Okay, great. So it looks like we're coming to our last question. As a reminder, please feel free to continue. Oh, actually, we just got another question. Let's see. Actually, it looks like, well, actually, let me ask this question and then I can sift through the new questions that are coming in. So will wearing a mask help me? Is that important to do right now?
Good question. So, everyone is likely now familiar with the newer CDC guidance that everyone should be wearing cloth masks when they go out and are not able to practice good social distancing efforts. And so that means anytime you have to go to the grocery store or the pharmacy or anything like that. Again, would as a side note, would encourage everyone to think about ways that you can avoid putting yourself in those positions, such as delivery, and especially delivery of medications. And we at Devoted can help you with that if you're interested. But if you are to go out, then cloth masks are recommended. The reason that cloth masks are recommended is because they actually help prevent people who have the virus from shedding the virus and spreading it to other people. So it's less so about preventing you from getting it and more so preventing other people from giving it to you. But if everyone wears them, and then anybody who potentially has the virus is wearing a mask, the risk of people giving it to other people decreases significantly. So it will help in the sense that it really helps prevent the disease spread generally if everyone does it well.
Okay, great. So one of the questions that we received right before asking that last question is question about nicotine via vaping or patch application to diminish smoking behavior. Is that considered the same thing as smoking?
It is, we're still very early in the experience with vaping. Vaping in general, however, is associated with a lot, unfortunately, with a lot of lung disease and some severe lung disease people were getting with vaping. So vaping generally is not recommended because you actually put yourself at increased risk of lung disease with vaping itself, and especially in the time now when we want to prevent any increased risk of lung disease. Vaping is not something we recommend. So vaping would not be something recommended. I think wearing a patch to diminish kind of smoking would be helpful and recommended. Really, anything that you can do to help reduce the amount that you're smoking is really helpful. And so, wearing a patch, or there are other medications that your doctor can actually talk to you about. In addition to nicotine patches or gum that might also help with cutting down on or quitting smoking. So those are all, there are several excellent options for you to think about. Again, vaping, not recommended, but nicotine patch, nicotine gum, as well as some other medications that are not nicotine related can help with smoking, with quitting smoking, and diminish your risk diminishing your risk of hello.
Oh, sorry, you cut off, but I think you got through most of it.
I'm so sorry.
Um,
Where did I cut off?
yeah, I think you were just wrapping up. It was probably about
Okay.
10 seconds ago. Yeah.
Okay. Sorry.
Um, no worries. So I guess, so another question that came in, and it seems like a pretty clinical question, is syndrome X a precursor to the onset of diabetes, and is hypothyroidism a contributor? Dr. Carter?
Yes, I'm so sorry. I just cut out again, so I did not hear what you just asked me. I
Sure.
apologize.
Follow-up question to the last question is syndrome X a precursor to the onset of diabetes, and is hypothyroidism a contributor?
Great questions. So, syndrome X is also known as metabolic syndrome, and that is basically a cluster of conditions that might include things like obesity or being overweight, having high blood pressure, having high blood sugar, and having abnormal cholesterol levels. All of those contribute and are considered part of metabolic syndrome or syndrome X. And it can be a precursor to the onset of diabetes. Many times with syndrome X, you will have prediabetes. So your blood sugar is elevated, not enough to be considered diabetes, but elevated beyond normal. And so it is a risk factor for going on to develop diabetes. And so treatment for metabolic syndrome or syndrome X includes being really, really diligent about things like diet and exercise, but might also include treatments for diabetes itself, actually. Things like metformin, the medicine that I mentioned earlier, is often used for treatment of metabolic syndrome as well. And so maybe something to speak to your doctor about if you're worried about metabolic syndrome. Again, it is a risk factor for the development of diabetes, as one of the features of metabolic syndrome is an elevated blood sugar, and a sort of an abnormal ability of your body to manage its insulin. And so it is unfortunately a risk factor for diabetes. The second part of the question was around hypothyroidism. So hypothyroidism is also low thyroid. So for those who aren't familiar with that, the thyroid is a gland in your body that makes hormones that help regulate your metabolism, among other things. And when you have low thyroid levels or hypothyroidism, that can do a few things. It can actually make you gain weight because your metabolism has slowed down. It is not directly connected with diabetes, however. And so while weight gain can be sort of a common thread to both of those, hypothyroidism itself is not a contributor to diabetes, unless the weight that you gained with the low thyroid was enough that it caused you to have more problems with your blood sugar and diabetes. But in and of itself, hypothyroidism is not thought to be a contributor.
Okay, great. Thank you so much, Dr. Carter. And actually, that brings us to the end of our session. So if you have a question that you would like answered that we didn't get to today, or if we didn't answer your question, please, as a reminder, to include your name and phone number in the chat. So I want to thanks so much, Dr. Carter, and thank you to everyone who joined and asked such great questions. As I said, if we didn't come to your question in Zoom, you can chat. And if you're on Facebook Live, you can give us a call at 1-800-DEVOTED. That's 1-800-338-6833. Thanks again for joining us, and please stay safe.